how would you then um, recommend non-pharmacological treatment of overweight or obesity?
hmm So I'm going to split it into the two different populations. I'm going to say the folks that were referred to us from the renal transplant group, they were there to lose weight to get in line to have a kidney transplant. And so there we would either use a non-surgical method, or sometimes they would go through our surgical pathway, have a bariatric surgery approach of some kind in order to lose weight and improve their metabolic health, and then have the surgery. On the non-surgical side, uh, the, uh, the main driver is what I call the continuum of care. You have a number of knobs that you can turn to try to help improve someone's health. You've got, of course, nutrition, and that's the big one. We'll come back to that in just a second. You also have the behavioral side of things, the coaching or counseling, because learning how to have a new relationship or a different relationship with food and eating and with weight is there's a lot of learning or unlearning and then relearning that goes on. Physical activity is always important. Interestingly, it's not as important for weight loss as it is for weight maintenance and for control of diabetes. Uh, and then, of course, we would use medication management. There are, as time has gone on, we have more anti-obesity medications that are workable, some of which work very well and are safe in patients with renal disease, and that's been a big deal. And then our fifth pillar would be surgery for those folks who need surgery. But it's to think of people in terms of this care continuum with these elements. Our major intervention, I think the one that comes at the beginning, is a nutritional strategy. And it's not enough, as I'm sure people have figured out. Anybody with a weight problem has figured out that it's a little more complicated than push away from the table, exercise more, eat less, and all will be well. That hasn't really worked out so well as a concept. So our programs basically have been very structured, but fitted to the person in the particular lifestyle approach that they may want to have.